Sixth most common language mistake is when we sign off the letter, we either write yours sincerely or faithfully. So most commonly witnessed mistake is yours is written like this, like without s. Your, not yours. It's incorrect. Other mistake is yours with apostrophe s, which is again incorrect. And another one is yours is correct, but sincerely s is sincerely is capitalized, capital S. So this is again incorrect. This one is correct, yours sincerely. Seventh most common mistake is incorrect use of tenses for improvement and deterioration. First of all, improvement and deterioration should be written in active voice. So most common mistake is that people write it in passive voice, like her condition has been improved, which is incorrect. Has improved. So let's see. The improvement and deterioration which is still relevant, we will write it in present perfect tense. Still relevant or has occurred recently, present perfect tense is the appropriate tense. Okay. So Ms. Sharma's condition has improved since the last assessment. It's correct, but has been improved, which is passive voice, is incorrect. Similarly, in the next example, Mr. Taylor's condition has worsened or has deteriorated since the previous visit. This is correct. Has worsened is in active voice. But this one, the next one, has been worsened. This is incorrect. Has been worsened, has been deteriorated. This is passive voice, which is incorrect. And the improvement and deterioration which happened in the past and it's not still relevant, then we'll write in past tense. Mostly past simple. We can write it in past perfect tense as well. Let's see examples. Mr. McDonald's mobility improved after physiotherapy sessions. This is correct. Next is Mr. McDonald's mobility was improved. This is passive voice and it's incorrect. Similarly, Mr. Smith's pain worsened after discontinuing the painkiller. That's correct, pain worsened. But next one, pain was worsened after discontinuing the painkiller is incorrect. So the summary of this whole conversation is improvement and deterioration should be expressed in active voice and in the tense appropriate to their current relevance. If they are still relevant, present perfect is the best tense. If they are not relevant, then past tense. Eighth most common mistake is not using and in a list or between two objects. First one, and at the end of a list. And is used to connect the final item in a list. When you have a list of things, we write normally and before the last object. Like the examination revealed pallor, tachycardia, and mild hypertension. So and before the last one. This one, the examination revealed pallor, tachycardia, mild hypertension. Use of comma before the last object is incorrect. This one is correct. This one is incorrect. So this is the incorrect way. Then and between two objects. And is used to join two related items. No comma is required since there are only two objects. So for example, let's see. The patient requires both physical therapy and dietary modifications. If we join these two two objects like physical therapy and dietary modification with a comma, that will be incorrect. The patient requires both physical therapy, comma, dietary modification, that is incorrect. Ninth most common mistake is not putting commas after introductory phrases and signaling words. The introductory phrase is the phrase which introduces the whole sentence. Okay? It can be a single word, 2 words, 3 words, anything. But we normally put comma after that introductory phrase. So for example, today Brandon was brought with persistent symptoms including sore throat, cough, and knee pain. So today is introductory word here. So after today we put comma here. Today, it means that we are talking about today's presentation. Today Brandon was brought with persistent symptoms including sore throat, cough, and knee pain. Next one, on 19, 11, 14. This is again introductory phrase. Next we add comma here. Mrs. Walter presented for regular checkup. Similarly, on examination, then comma. There were bruises on left arm. Next one, initially, comma. Mrs. Walter presented on 19, 11, 14 for her regular checkup. Then after discharge, comma, Mrs. David will follow up with you for continuation of care. Last one, at that time, comma, she seemed to be happy and was doing well. The phrase, the word which introduces the whole sentence. That what is going to happen? What are we going to write in the whole sentence? What is it about? For example, in today, we will write about today's visit. 19, 11, 14 means that what happened on that specific date. On examination means what happened on examination. Okay, the same way. So when we are writing an introductory phrase or any signaling word, we should put a comma after that. 10th most common mistake is not using apostrophe s to show possession. For example, Mrs. Sharma's non-fasting blood sugar levels are usually in 16 plus range. The incorrect way is Mrs. Sharma non-fasting blood sugar level are usually in 16 plus range. Here we are talking about Mrs. Sharma's blood sugar level. We need to show possession, like whose blood sugar level? Mrs. Sharma's blood sugar levels. We put apostrophe and s. If a name ends with s, for example, Mr. Thomas. If we write if Mr. Thomas non-fasting blood sugar levels are usually in 16 plus range, in that case we can only put an apostrophe, not s. We can omit s here. Mrs. Thomas non-fasting blood sugar levels are usually in 16 plus range. This is correct. If now our name is ending with s, we can only put apostrophe, but we need to put apostrophe s or only apostrophe when appropriate to show possession.